Hello everyone, this is Dr. Parinaaz Parhar, Clinical Head, Oasis Fertility, Secunderabad. Today I'll be talking about fertility preservation. Fertility preservation, as the name tells us, involves preserving your fertility for use in a future date. What does this mean? It means preserving your gametes, that is sperms in the case of males, and eggs or embryos in females for use at a future date when it is more convenient for you to plan a pregnancy. Fertility preservation mainly tends to benefit two groups of patients. One is where because of some cancer or because of some autoimmune condition, the patient's gametes, eggs or sperms are threatened because of either the disease or its treatment. In these cases, the patient is usually advised to get their eggs or sperms frozen before they start the treatment for their condition. It's also helpful for those patients who are suffering from a condition known as endometriosis, where this particular disease slowly eats away at their ovaries and the ovarian reserve. Fertility preservation nowadays is also very popular amongst single ladies or those of us who are very busy pursuing our careers and would like to delay pregnancy to a later date in time, but want to preserve our fertility at our current age. In men, the fertility is preserved by freezing the sperms, and it's a fairly simple procedure where the male is asked to come and give and ejaculate, and it can be frozen for years together. However, it's not so simple in a lady. Ladies would need to take daily injections for approximately 10 to 12 days so that we can try to get as many eggs ready in a particular cycle and freeze them. The number of eggs which would be sufficient to get the desired number of embryos is mainly determined by the age of the patient. If you're someone who has a good ovarian reserve and are relatively young, you might get the required number of eggs for safeguarding your fertility in one cycle of stimulation. However, for patients who are older, they might need to go a couple of more cycles of stimulation to get the required number of eggs or embryos. Now, in ladies, it's usually the option of either preserving your fertility by storing it as eggs, or in case if you have a male partner, freezing your eggs after fertilization as embryos. Usually, if you have a male partner, it's preferable to freeze it as embryos because the survival rate of embryos post-thawing is better. However, nowadays with better techniques at hand and better techniques of cryopreservation, we're getting equally good results with freezing and thawing of eggs. Fertility preservation technique has helped millions of couples across the world to realize their dream of parenthood at a later convenient stage in life. It's important to remember that your gametes can be stored for years together, and the children who are born out of this procedure are known to be as healthy as those conceived through natural pregnancy.
For more information and updates, subscribe to Oasis Fertility. Hit the bell icon for future notifications.